So still got the poll running. Interesting to see that Care Supports and virtual support is up there as of real interest to people. If you haven't voted in that poll, please do vote in the poll and give us an idea of what of these solutions might meet some of your priority challenges. Stephen Gerling is waiting in the wings from Tech and Care. Stephen, excellent. We can see you.
Hello, Jane.
We can hear you. Fabulous. Excellent. I'll leave you to tell everyone around hospital to home. Thank you.
Thank you. Great. Yeah, well, it's great to be here. Great to speak to everyone. Yeah, thanks, Sam. We could get started. So I want to start off by talking about how sometimes there comes along a shared challenge and a coalition of the willing join together. And then through the spirit of innovation, they find a solution. And then people ask, how did this not exist before? And so hospital to home, I think, is an example of that. And that's what I'm here to talk about today. And also to certainly invite you to join at 1 o'clock and come to the demo that we'll be doing then. And if we can move on to the next slide. Thanks, Sam. Oh, sorry, we could just go back one. I think it might have jumped over the introductory slide. Oh, is it not? Is this the next one that's queued up? Okay, I'm just going to roll with it. So I did have a slide, sorry, to begin, just to give you my name. So my name's Stephen Gerling, and I'm the product owner for Tech and Care. So I'll talk to you about hospital to home today. We do have a website as well, which I encourage you to visit. So we'll post a link to that. And we have a Twitter account as well. So we'll give you the handle for our Twitter account as well and invite you to follow along there. So if you do want to keep up to date with news about hospital to home and the work that we're doing and how we're engaging with the D2A, the discharge to assess process, then do follow us on Twitter. So we'll make all of those available. But really, what is hospital to home? So we're here to talk about hospital to home. So what is this solution that has been developed? Well, it's all around removing the discharge to assess complexity, to how to really get into ensuring patient safety and improve D2A management. And so how does it really do that? Well, we know that there's a huge amount of hard work and goodwill and effort that goes into the D2A process at the moment by health and social care professionals in local authorities and hospitals. But because there was no one source of truth, so much time and effort was given to phone calls and emails and spreadsheets, being on wards, asking questions, just to try and keep track of all these discharges that were going on, and then following them through to their assessment at home, or indeed where they were being discharged to. So hospital to home came along to try and provide that one source of truth, to give that overview of who is doing what teams are involved, what case managers are involved at any one time, and give that live data that's refreshing instantly, so that we always know where are these people that are on this D2A process, whereabouts are they in that journey, and give that view to the people that are actively managing them through out of hospital and to be assessed at home. So that's really what hospital to home is trying to drive to do. And by providing this view, patient safety then is ensured, improved, it reduces the amount of confusion around delays, and it gets people out of hospital more efficiently. It gets them home where they have the best chance of recovery. So we know that when people go home, they've got the best chance of recovering. We want to get them out of hospital as efficiently as possible, and that's what hospital to home is seeking to do, is to really improve this discharge to assess process, remove that complexity. And there's a quote on the screen there as well. So Marion, who you heard from earlier from North Lincolnshire, spoke really well about hospital to home and why hospital home is important and what it's done for North Lincolnshire. And Wendy as well from North Lincolnshire, there's a quote on the screen there around hospital to home providing that one version of the truth and how it's stimulating a different conversation. And there's a really key point there about having system conversations now, being able to elevate out of the day-to-day and those emails, those phone calls and those spreadsheets, and taking a step back to look at the process more holistically, to really look at how it's performing, and then hone in on those areas that need improvement, and look at the areas that are doing well and build on those successes as well. So having that, being able to have that system conversation, because everyone can see the right information at the right time, see the progress, so that people are discharged home safely. Just wanted to share that quote with you as well. So just to give you a little bit then about the history. So actually Marion's talked about this and Jane already today. So I won't go into the detail of this, but it did come from that social care digital innovation accelerators, that SCADIA project that ran last year. And it was one of the 3 then that was shortlisted to be taken forward. And as part of CC2I writing out to the heads of adult social care across the country, D2A was identified as being one of the key pain points that came back, and so it really was then identified as one which warranted and merited a digital solution, and so that then went out, and so then a public sector led approach to developing a scalable and sustainable solution that will transform the D2A process then came about. So that was the history. It came from that SCADIA initiative through then into writing out to those heads, and then pulling together this team who are going to tackle this issue. And if we go to the next slide, please. Thank you. And then so this is then the project team that came together. So we had Sutton came together with Birmingham, North Lincolnshire, Southend, Herefordshire, with funding to attack this project and attack this solution, and matched funding then by the LGA and NHS Digital, supported by CC2I, and Maldaba then were the development partner that came on board in order to develop this solution and to take it forward. And it was interesting to reflect back on the conversation that happened earlier. It was to reiterate what Devon said, it was a fantastic conversation, fantastic panel conversation to listen into, and the importance of this co-fund approach, this collaboration, but also sometimes then partnering up with the people that can then develop at pace. So Marion talked about Maldaba coming on board and developing at pace to get to that MVP stage to go live in February last year, and how that partnership working is key when it comes to tackling these problems and working innovatively and looking at sustainable and scalable solutions for the future. But that's the project team that came together. And so why was that important? Well, again, building on really what's been said earlier, but it's all around that true collaboration and the commitment to the co-design approach that then fed into hospital to home, and then is embodied really in what hospital to home is, what it looks like, and again invited to come at 1 o'clock to see the solution, to see how it's been designed, with the end user really at the heart of it. It's all around making the process as simple as possible, minimal amounts of data that's in there, and it's designed by health and social care subject matter experts that we saw from the project team there, and it's for health and social care professionals as well. And so we want to show that in that demonstration, show you how that's come to life, how it doesn't replicate the patient record. It doesn't replicate what's in the electronic patient record in the hospitals. It doesn't replicate what's in an adult social care system in the local authority. This sits in between those two. This is the gap that was identified and where hospital to home came in. So you've got your EPR, you've got your adult social care system, but what sits in between them, and that's the place for hospital to home. That's where this solution came in. So we'll talk about that. We'll talk about how those principles have informed the development of it. And most importantly as well, we'll look at the efficiency savings that hospital to home will bring, the benefits, and how it will improve the provision of care for people. So how does it get people out of hospital sooner? How does it break down those barriers that exist at the moment? Thanks, Sam. And so realizing the benefits, again, at 1 o'clock, we'll go into this in more detail, but the benefits of adopting hospital to home. So the project partners from last year looked at a minimum 30 to 50% administration reduction when you kind of cut out all of that back and forth with the manual workings in the spreadsheets. At 30% administration reduction, local authority administration saving per D2A, looking at around just short of £25. And when you think there could be between 3,500 to 18,000 possibly D2As per year for a local authority, for an administration, that really does scale up. And then the big one really then is around these savings on the bed night savings. So we're saving 1 every 2 D2A, and that's saving the £200, which could be, and most likely is, a conservative number. Now we've had some feedback that when this was put together last year, even since then, the cost of a bed night, that could be higher now for some localities. So when you think about the number of D2As that you have over the year and the number of bed nights and saving 1 bed night per D2A and how much that costs, that really does scale into quite a substantial saving. And if you come along at 1 o'clock, we'll talk a little bit more about that. We'll talk about how we can calculate that and how we can help you create a business case to make the case for change as well in your locality. If you are interested in hospital to home, we can help you with that, help you make that case for change. So we'll talk more about that at 1 o'clock. And just to give you a little bit on how it's going. So North Links, as Marion, you heard from earlier, he's using it. So, and talked about a lot of these and talked, far more elegantly than I would about how it's going at North Links. But just to kind of give you that idea of how this is going in live, in practice with North Links who are using hospital to home, and how it has been adopted well, and giving that one version of truth. Really importantly, it's enabling those conversations, as Wendy said in that quote as well, to go up to a system level conversation. You've got that one version of truth. It cuts out the back and forth, the blame culture, gets rid of that. We can see what's going on in front of us on the screen. Accurate reflection, and importantly as well, that return on investments. If you are to invest in hospital to home, what are you going to get back? And the 30% saving on administration, speeding up discharges, and they're now seeing one of the best length of stays for 21, 14, 7 days. And we're doing some work at the moment to quantify all of that, to tell that story, and we can certainly make that available to people as well once we've done that work. But really cutting down on the numbers of people that have got a length of stay over 21, drastically reducing that. So really seeing some great benefits being realized and some great stories at North Links, and that's what we want to see across all of our customers as well. And if we go to the next slide, please. So just a little bit more about what's coming up at 1 o'clock. So with the demonstration, so see how hospital to home has been designed and how a person's managed through that from discharge to assess, or take you through the system, really show you all about how that works, show you about the principles that have gone in to developing it, the data minimization, how IG have had a real influence in the development of the system, and audit and reporting, and how it's really straightforward to administrate the system. All of that I'll take you through the solution, learn more about those benefits and how they're realized. We'll talk a little bit more about how we can calculate them, and also about the business case. So how we will support you with the adoption of hospital to home, how we can support you making the case for change, and how we can support you in embedding hospital to home into your organizations. So I do hope to see as many people as possible there at 1 o'clock. Great to take your questions, and we'll do some polls and look at a few different things. So thank you very much. My name is, as I say, Stephen Curley. My email address is on the screen for you there, the link to the demo session. Thank you.
Fabulous. Thank you so much, Stephen. I loved your first screen with those. I thought there was something wrong with the screens again, and then I realized you were doing an inventive or creative way of doing the screen. Okay, so we've got the link there to your sessions just come into chat. So anyone who wants to, hear Stephen's outline what he's going to be doing, then please jump in there at 1 o'clock. Thank you, Stephen. You're a star. Nice to see you.
Yeah, you too, Jane. Thank you very much.